It's a great day's Medical Monday. For years, people with chronic back pain had to turn to painkillers or challenging surgeries to find some relief. But Dr. Naveen Subramanian is using a cutting-edge procedure to not just ease the pain, but to make it go away. Please welcome him back to the show this morning. This is one of those areas, Dr. Subramanian, where the back pain, where a lot of people just kind of throw their hands up and give up.
Right. Well, as we all know, back pain is a very common disorder. The literature suggests that 80 to 90% of the general population visits their doctor at some point in their life for the treatment of back pain. Yeah. And the vast majority of those, at least 90% of those people, do not need an operation. But there are some cases where the pain progresses, develop leg pain or weakness, and non-operative treatment doesn't work. And in those cases, surgical treatment may be of benefit. Yeah. But the problem, and the problem for me when I started practice, is the surgical treatments available were maximally invasive. They were high risk, and
sometimes could cause side effects, yeah, other problems, right?
And they can cause complications that sometimes could make the patient worse. So, but newer techniques have developed to where you can approach the same problem, perform the same procedure with a much more minimally invasive approach and a lot less iatrogenic or surgically caused problem to the patient.
Yeah, you're not causing extra scar tissue and all that type of stuff.
Right.
Judy is with us this morning, and Judy, you suffered from back pain, which again is one of those things that can just literally put you flat on your back.
It did.
And what types of things had you tried to try and address that?
Chiropractor?
Yeah, the chiropractor, right?
I tried nervous.
It's okay. It's okay. There are a lot of people out there right now who can certainly identify with what you went through, but you're right, you get desperate and you try the chiropractor, you try the pain medications.
You name it, I tried it. As long as it wasn't invasive, I did it.
All right. So it used to be a back surgery is one of those things, too, like you said, that was just very aggressive. What has changed in medicine and technology that makes it something that's easier to do and pretty much the results can be much better outcome?
Well, the spine surgery community had also recognized the actual iatrogenic or surgically induced problems that the surgery caused. Mm-hmm. So the medical community was looking for an approach to address the problem without causing other problems in turn.
Right, because you had to be really serious about having back surgery at one point because of all those side effects.
And don't get me wrong, I still think you do.
Yeah.
I still think surgery is the last resort, really.
Yeah.
But if it does come to that, I think an approach that causes less problems will in turn give you a better outcome. And in a quicker recovery, which will allow people to get back to work quicker and support their families quicker.
Yeah.
That was the other problem with the open approach, is you were out of work for so long, a lot of people couldn't do that because they needed the income to support their families.
Yeah, which means they would load up again on the pain medication that
Correct.
Really wasn't working. Okay, so let's talk about exactly what happens when you do the surgery that makes it a better way to go.
Right, so classically, in order to approach the spine, you make a long midline incision and you dissect all the way down to the bones and basically just strip off all the muscles until you completely see the spine.
Yeah.
Well,
that's a lot of trauma to the body, huh?
Yes, that's a very aggressive technique. But in the minimally invasive approach, here you can see Judy's x-rays, which basically show what we call degenerative disc disease, which is a collapse of the disc segment in the lower spine. It was these holes right here are where the nerves exit, and when you get the disc space collapse, those nerves can get pinched. And that is not a dangerous problem, but it can be a painful problem. Mm-hmm. And we try to address those non-operatively in the vast majority of cases. Here you see the disc space collapse. This is looking at an MRI of her spine. And if we can get the next film.
Okay, the next one. There we go. Post-operative.
This is her post-operative x-ray, where you see, in order to address that, we put, I don't know if you can see it very well, but there's a spacer or a cage in there that holds this space up, prevents it from collapsing further. And then these screws stabilize that until it heals. Now, classically, like I said, you'd make a long midline incision here and basically expose the whole spine. With the minimally invasive technique, I make 2 small 1-inch incisions on each side, use a microscope really to go in there and clear out the space for the nerves and to get into the disc, elevate it back up, and then stabilize it with the screws. The surgery was just over an hour long. Judy, I think, was in the hospital maybe 1.5 days, and she was pain-free within a couple weeks, and she's a year out now and still doing fantastic.
And yeah, absolutely. So obviously, anybody who is listening to this who's just, has been frustrated, thrown their hands up, what would you say to them?
See Dr. Subramanian. He's my God. I mean, I had a very, very long process of pain, 7 years. I wasn't able to do anything because invasive procedure was not in my book. And I was recommended to him. I went to see him. First of all, when they said surgeon, you know, I cringed.
Yeah.
But I said, no, let me, all I need is a consultation. We'll do it. And I was up and about in no time. It was just
Long story short,
fabulous.
you got your life back, too.
Oh, my, yes.
All right. For more information on Dr. Subramanian's procedure, you can call 713-650-6900, 713-650-6900, or log on to his website at HoustonSpineDoc.com, HoustonSpineDoc.com, or OADoc.com. Thank you very much. We'll be right back.